Hello, everyone. Welcome to today's presentation. My name is Brandon, and we're going to talk about squat loading position considerations so that you can learn how to choose the right tailored squat variation to meet your client's needs. Why does squat loading position matter? Well, if you think about the fundamental movements, there really is no other fundamental movement that we can tweak and change and modify the loading position as much as the squat. And for the longest time as a personal trainer, I did not think too much beyond loading position for a squat other than a front squat or a back squat. But there's really so many more variations than that that can profoundly impact your client. So another big reason why we're going to talk about squat loading positions is because ultimately it's going to help you make better programming decisions for your clients. All of your clients are coming in with different needs, different issues, different goals, different demands, and we can use this single variable to really help individualize their training, and they're going to appreciate that a lot more. It's just one other thing that you can do to give them a better experience. And experts, this is a quote from a research article that I read talking about loading position. So I want to share that. This comes from Park et al. In 2022. And they write, experts must apply the bar position and load as an important variable that affects the intensity and the method for training. And this targets muscle strengthening of the lower extremities and the trunk. Another quote that they say is that appropriate exercises should be applied to the participant's functional state accordingly. So what that means to me is that loading position matters. It's an important variable, and it can help make or break an exercise or a squat exercise for a client. So I want to take you on a deep dive in understanding how this one variable in exercise can make such a large impact and should not be overlooked. And we know that there's a lot of ways that we can modify a squat other than loading position, and those are all important. However, loading position should always be considered when we're programming a squat for a client so that the client does not have minimized training benefits or learn improper techniques or get injured. And that last sentence I said was actually a direct quote from another study from Chiu et al. In 2011. And I'll just say it again. They said that loading positions should always be considered when programming a squat so that the client does not minimize training benefits or learn improper technique or get injured. You could be teaching them a squat and they can do a great body weight squat. You're a great coach, awesome. But then you load them up in a way with a loading position that's just not optimal for them. And that could teach them improper technique. That could help, that could get them injured eventually. So that's why this is so important. And we as personal trainers, we want to try not to remove a fundamental movement from someone's training if possible. Sometimes we need to do it, but this is another variable that you can explore and tweak with that could hopefully help you have an entry point squat exercise for your client. So we want to understand how all of these variables work. Other variables in a squat and many other exercises are range of motion, stance, and they all affect our client's specific situations. So let's get started. Lastly, and not get started quite yet, I'm going to continue this introduction. I've got another slide that says why it matters. And I'm just going to say that over 85% of the population in their lifetime is going to have some sort of musculoskeletal injury. That comes from Trumpeter et al. In 2017. We're going to be working with people with past injuries, current injuries. They may get injured in the future. And we want to ensure that the squat exercise that we are having someone do helps keep their spine neutral. Because as the quote says from Clark et al., loading position of the squat matters for spinal stability. And that affects athletic performance, that affects injury prevention, and sport-specific differences lead to different loads on the spine. So if you look at those pictures right there, the soldier wearing that super heavy backpack, that backpack probably weighs 80 pounds. It probably weighs a lot. You think that's going to have some sort of adaptation on that soldier? You think that he's going to need to train a squat differently than that shot put athlete? Most certainly, yes. So that's why this matters. Before we get into the research, we're going to break down the squat a little bit so we can really understand what the squat is. So a squat is a fundamental movement pattern. Do you know what fundamental movement patterns are? Well, there's between 4 and 7, sometimes 8 fundamental movement patterns, depending on who you ask. I like to boil them all down to push and pull and squat and hinge. Some people like to say a lunge goes in there, but I think that's a knee dominant exercise and that can go in the squat. People say rotation, carry, plank, gait, but I like to think of all those as glue that holds together squat, hinge, push, and pull. Furthermore, a squat is a closed chain exercise, and that is when the distal end is fixed and the proximal body moves around the distal end to overcome the resistance. In this case, the distal end is the foot, the proximal body are the glute muscles, the quads, and a lot more. And we could see there's the 3 main lower body joints are used. There's a lot of different variations. There's just a few pictures right there that you can see. And of course, we can break it down even further into unilateral or bilateral. And today we're going to be talking about bilateral. However, I think that all the loading positions that we're going to discuss for bilateral can just as much be applied to unilateral as well. So I've been talking about loading positions for about 10 minutes now. And how would we define a loading position? Well, I would define the loading position as the position of the external load on the freestanding body, whether that's a barbell, a kettlebell, a safety squat bar, or something else. There's a lot of different loading positions out there, and we're going to break down a lot of them and see what the research says about them so that you can make informed programming decisions with your client. I've made this spectrum here to help you visualize from back-loaded all the way to front-loaded so you can see where some common exercises lie. So for squats, you can see Smith machine all the way in the back. And I put a question mark there because I'm sure we can argue that it can go somewhere else. But for Smith machine, typically you stand with your feet in front of the load because you can lean back into it and that's how you are stabilized. So that load is way back there. On the all the way opposite end of the spectrum, the landmine front squat. When you do landmine squat, you put that plate on the bar and it slides down to the end of the barbell, and then you're holding the barbell on your chest. So that weight is like a foot or two in front of you. So that's a huge difference in the way we're able to load the squat. Think about all the other exercises. Can we load an exercise with like almost a 3 or 4 foot difference? I mean, I'm sure we can make some arguments out there, but none of them are as clear to make as for the squat. And that's why we're talking specifically about the squat. Before we get into the research, we need to understand some basic physics terms, and that is torque, moment arm, and moment. So torque is a measure of the force produced by the muscles through the moment arm that cause the object to rotate. So it's essentially the amount of tension and force the muscles create to move our body through the joint. And torque is a rotational force because there's rotational forces through our joints. A moment equals force times distance. So torque times distance of the load to the muscles worked. And lastly, moment arm is the radius at which the force acts. So we can see in the purple line in the picture of the blue and red plates, you can see there's a different moment arm there for the front squat versus the back squat. Do you think that's going to have implications on how the body moves and receives that load? Absolutely. Another picture we're going to get into. Actually, we're getting into it right now. We are going to talk about the research now. So I want to talk about how we're going to go through the research. I'm not going to get into the methods and talk about the very specifics because we have a lot to get through. So I include some bare basics in the table where you're going to see the amount of participants, the population that was studied, and the variable they used. to study the different loading positions. So usually that's going to be some sort of 1 rep max, 8 rep max, 70% of a 6 rep max, anything like that. All of these studies are crossover repeated measures, and they all use very similar warm-ups. EMG setups is pretty standardized with small variations. And I know you're probably like, well, what did you just say? Repeated what? Repeated measures crossover design. That is a type of study that involves multiple measurements of the same variable taken on the same or matched subjects, either under different conditions or under 2 or more time periods. Well, that was a lot. So let me just paraphrase that, make it even more simple. Okay, repeated measures, you're going to repeatedly measure the same variable. In this case, the same variable could be muscle activation of the glutes. Okay, we're going to look at that. We're going to repeatedly measure that under different conditions. Those different conditions is front squat versus back squat, high bar versus low bar, Smith machine versus barbell back squat. That's what a repeated measures crossover design is. All right, time for some research. Let's get into it. This study is called A Biomechanical Comparison of Front and Back Squats by Gullett et al. In 2009. You can see they looked at front versus back squat. You can see those variables down there. And what's important is that we always consider the subjects that they're using, because competitive bodybuilder is not always going to apply to another type of population. All right, so the biggest thing I want to tell you about this study is from the practical application section. Gullett said that the front squat was as effective as the back squat in terms of overall muscle recruitment, with significantly less compressive forces and extensor moments. So what that tells me is that if I have a client who loves to back squat and they're starting to get nagging injuries, and then they're like, oh, I don't want to stop back squatting, I want to make progress. Well, we can tell them, hey, the research shows that a front squat is just as effective as a back squat in terms of overall muscle recruitment. If we look right there, muscle activity in the thigh, they didn't find any difference. And that's interesting to me, because I always heard that front squats, you're going to get more quads. Now, there is some research that does show that, but we gotta look at it from a whole perspective. And then, okay, less compressive forces on the knees. That can be because typically you lift less weight in the front squat, and because of the biomechanical difference of a front squat. Our body is always going to try to keep the load over our base of support, and it's going to move our body in different ways to accomplish that. That's why in this last picture, we can see a difference in the kinematics in the joints between the front squat and the back squat. All right. Another thing that Gullett et al. Said in their practical application is that these results suggest that the front squat may be advantageous compared to the back squat for individuals with knee problems, due to that there being less compressive forces on the knee. So if you've got a client with knee issues, you're looking for an entry point exercise, the front squat might be a great one, barbell front squat, maybe goblet as well. That makes sense to me. Lastly, Gullett cited that front squats could also be useful for individuals with shoulder problems, because in a back squat, that requires a bit of shoulder mobility. And for the front squat, you can do this crossover technique where the arms go on the shoulders, or you can get wrist straps, attach them to the barbell, and then hold those straps, keep the elbows up. So there are some great practical applications right off the bat when we look at the difference between a back squat and a front squat. So just, well, actually, we're going to move on because I do have a summary slide for each comparison. So moving forward, from Cortella et al. In 2021, this is looking at the activation of muscles in different squat variations. You can see there's some different metrics that they looked at this time. They looked at the spinal erectors. They looked specifically at not just quads in general, but rectus femoris, as well as the vastus muscles as well. And they found that for the rectus femoris, there actually was more for the front squat. So it's like, okay, that makes sense. We kind of heard about that before. You get more quads in the front squat. We look at the group, though, they're very well trained. They're competitive bodybuilders. So we have to take that into consideration. And there's a little more glutes as well. And notice they're doing 80% of a 1 rep max. I think results would be different if they were, say, doing 10 reps of like 80% or something like that. It's going to change. So we always got to consider these variables. All right, so Portella's practical applications for us, the reader, is that the front barbell placement seems to be a good option to increase glute stimulus while squatting, and quads as well. Also, they looked at squat stance, and they found that a larger foot stance increases thigh muscle activity, specifically in the adductors. And I think that's because the adductors are then placed in a little bit more stretch, and it's a little bit more optimal force length relationship where they're able to contribute, create more tension. And they also looked at squat depth. And Portella et al. Said that squat depth does not seem to provide or promote a specific difference in muscle activation, with the exception of the rectus femoris gets more activation in a deep front squat versus a deep back squat. So what this tells me is, hey, I probably don't need to make my clients get deep right off the bat. It's like not that high up on the priority for me, because they're going to get as much squat activation getting to parallel. And that's what they looked at, parallel versus deep. So here's some more interesting things to think about for front squat versus back squat. All right. Last study we'll look at for front versus back squat. This study by, I don't think I'll be able to say that. I'll just say Kip, K and Kip et al., 2020. They looked at, peak hip extensor moments. And they found that there was a lot more hip extensor moment in the back squat and a lot more knee extensor moment in the front squat. And I think that has to do with the kinematics, the kinematic demands of the lift. So looking at a front squat, you're much more upright and you have more knee bend. So that makes sense why there's more of force in the knee area. For a back squat, typically you have a smaller hip angle, you're leaning forward more. So that makes sense to me, right? So it's just good to see this in research. All right, key takeaways for this research dive on back squat versus front squat is that front squat may achieve similar muscle activation despite 33% lower load. The way I see this helping a lot of people, and I mentioned this earlier, is people who just train barbell back squat day after day, and they're just getting tired, fatigued, their central nervous system just can't keep up, and they're starting to get nagging little pains. Well, we may want to encourage those people to take a week or two and do a front squat instead. It's going to have similar muscle activation, but give their body a chance to recover a little bit because they're lifting less load. Next, we can recognize that the back squat has a lot more, it works the hips more. There's a bigger moment generated kinetically, what research found. And then the same goes for front squats with knee extensors. Another thing, front squat has less compressive forces on the knees. So we want to take that into consideration with clients who are concerned about their knees. And we can say, hey, if you're concerned about your knees, let me show you a front squat because it's been shown in research to have less compressive forces than maybe the back squat that you're familiar with. So my advice to you is to select the variation that facilitates the most stable spine and makes your client feel the best. All right. I'm going to give a couple other things before we move on. And I want to say that these muscle activation discrepancies in joint angles may result from just the differences in the participants, really. We saw some pretty differing results, like, okay, do front squats do more quads or do they not? Well, it's hard to say because each study used different types of participants. So it's difficult to conclude 100%, but we can get some idea here that okay, if I'm creating a more knee extensor moment in a front squat, I might be getting some more quads there. That makes sense to me. But we're going to need more research to provide an authoritative text on this matter. All right. We're going to break down the back squat even more and look at high bar versus low bar. So bar position influences the center of mass, and the body has to position itself to maintain its center of mass over its base of support. So if we look in the right picture, we can see that that center of mass is over the base of support in both pictures. However, the body positions itself differently to accomplish that. We can also see differing moment arms in the knees. For the blue, there's a bigger moment arm in the knee. So it's probably a bigger knee extensor moment, right? That makes sense. We just learned about that in the last couple slides. All right. First study we're going to get into for this is the biomechanical differences between high bar and low bar by Glassbrook et al. This is actually a meta-analysis of 41 studies. So we got a lot of information summarized for us. And what they found is that as forward lean increases, it's been shown that the lumbar spinal erector muscle activity increases as well. Well, for low bar, there's more hip flexion, there's more forward lean. So there's going to be more erector spinae muscle activation. So if we have clients who are really, really tight in their low back and they stabilize with it and their backs get tweaked a lot because they're super apprehensive, might not want to do low bar because that has been shown to increase the muscle activity right there. Also, a wider stance is more common with low bar back squat, which has been shown to increase activation of the glutes and adductors. Furthermore, larger loads can be lifted with a low bar back squat. It's just a little more biomechanically advantageous. And that results in overall greater muscle activity and potentially larger increases in strength and muscle size. However, if we're looking to induce more anterior kinetic chain and quad adaptations, this study advises that we use the high bar back squat. So in the practical application of this meta-analysis, I pulled this data to put in this table, and they said that practitioners who are seeking to develop posterior chain musculature, which would be gluteals, hamstrings, and erectors, may seek to use the low bar. In comparison, those seeking to replicate movements with a more upright torso and contribute to the quadriceps may rather seek to use the high bar back squat in training. So what I think about is like, okay, what sports are more like upright, really require you to have an upright torso? I think probably like basketball would be one. So maybe for basketball players, a little bit more of a front squat. That's just a way to start processing this information to put it into something practical. So I'll stay on the slide for a little bit longer so you can just really make sure we soak in that table. There's less squat range of motion for the low bar. There is less quadricep activation for low bar, less knee flexion. So if we have someone who has knee flexion induced pain, we might want to do low bar squat if squatting is important to them, if it's valuable to their programming. If they have hip flexion induced pain, we probably don't want to do low bar because there's a lot more hip flexion. So those are the type of things that I really hope that you're catching on to so you can start making better programming decisions with your clients. All right, the influence of loading position on the muscle activity of the trunk and lower extremity by Park et al. 2022. And they found that compared with low bar, high bar exercises are performed with a more upright torso. All right, yeah, so we knew that. We heard about that already. And that the moment arms of the knee and ankle joints are relatively larger. One of the most interesting things about the study to me is the anterior pelvic tilt findings. I thought that was really cool that they tested for that because I didn't see that in any of the other dozens of articles that I scoured when I was creating this presentation. And that is really important to me because anterior pelvic tilt is really why I went on this research deep dive personally, because I tend to have an anterior pelvic tilt. And when I squat, even more so. And what that does is it makes me not engage my abs, and I engage my low back muscles to stabilize. My low back gets sore. This is not good. So I started transitioning from back squat all the way to front squat. Because if we see here, if there is less anterior tilt from low to high, my hypothesis is that there's even less tilt from high bar to front squat as that load moves forward. And sure enough, it's so much easier for me to get my hips neutral and engage my core when I squat. So I just love that they included this part in the study. So if you have a client who is struggling with an anterior pelvic tilt, get them at least a high bar, if not even front squat. And I've seen this just anecdotally with my own clients. I have a client with lots of lumbar flexion, lots of posterior pelvic tilt. I have them do back squat, low bar, and that helps them get those hips more neutral. All right, so I put all the different muscles that have less activation. So for high bar, there's less erector spinae, less abs, less transverse abdominis. This might be because there's less load. We can never be 100% sure, but that's what they found. Deeper range of motion for high bar as well. All right, so in the practical applications and the summary, what they said is that these results indicate that the degree of trunk bending and the change of the moment arm of the lower extremity joints are related to the muscle activity of the trunk. So when performing these two back squat movements, the muscle activity of the trunk and lower extremity is different, and the appropriate exercise should be applied to the participant's functional state accordingly. Lastly, lastly, as the load increases during a squat, the muscle activity of the trunk and lower extremity increases as well. Now, I thought this was kind of a contradictory statement to what we just talked about earlier with front squat, right? We found that front squat lifts on average 33% less load, but it achieves similar muscle activation. But this is saying that the higher the load lifted, the more muscle activation. So we're going to run into these little contradictions in the research. It just makes it interesting. We can really helps us ponder, think about it more. But I think that the results from what we talked about with front squat really do hold true. All right, so key takeaways for high bar versus low bar is that anterior pelvic tilt increases with low bar back squat. Trunk muscle activation increases with low bar back squat. And that is because there's a lot more leaning forward. There needs to be a lot more stabilization because there's a longer moment arm right there. Use low bar back squat to develop posterior chain hip musculature. Use the high bar to replicate movements with a more upright torso and training the quadriceps. All right, moving along to safety bar squat. Looking at these pictures, I want you to note the difference in the types of safety squat bars. Unlike a standard barbell that's 7 feet long, 45 pounds, 28 millimeter grip, there's a bunch of different styles of safety bars. So this is going to make researching the matter a little bit challenging. All right, first study by Christensen et al. 2021, and they compared 3 different types of squats: safety bar, high bar, low bar. Let's go through it. Highest load lifted, low bar right off the bat. That's just because it most optimally engages the strong posterior chain hip musculature, because the body is going to get the job done. It's going to align that center of mass over the base of support. And low bar is just a really biomechanically advantageous position. Also note that the low bar is the most posterior loaded position we've talked about. And for the safety bar, typically safety bar squats have that load shifted forward a little bit. So that's really important to know about. The load for safety bar is a little bit more forward than for a back squat. They found for safety bar, it worked the most glutes out. Well, that's pretty interesting because it lifts the least weight, but it worked the glutes out the most. It got the most activation. I should be more specific. Other lower extremity muscles, no difference at all. Okay, so quads, no difference. Hamstrings, no difference. Looking at the kinetics, knee extension moment have the most in safety bar squat. Now that makes sense to me because the weight is most forward. You're getting a lot more knee flexion since the torso is more upright. Makes sense. Hip flexion moment, it's got the least. Okay, that totally makes sense because the knee flexion, there's a ton of knee flexion. There's a big knee moment. It's got the most upright torso. Yep. Barbell kinematics, no difference at all. Barbell moves the same way, keeping that center of mass over the base of support going in a straight barbell path, straight down. So, in sum, from the summary of this article, in the practical applications, is that the safety bar squat produces more EMG activity in the glutes with less load lifted. And the upright torso angle might be ideal for decreasing the forces in the low back. So if you've got a low back client, you're looking for an entry point squat for them, safety bar might be really good because they're very upright. There's not as much activation in the trunk muscles and the low back muscles. And this author attributed this to there being less hip flexion, which results in less load relative to the back squats. So we can see in the first metric that there's less load lifted for the safety bar. Well, why is that? Why do you think there's less load for the safety bar? Well, really it comes down to it not being as advantageous biomechanically because that load is more forward. So it can't fully engage all of the posterior chain muscles as much as low bar. The forward camber of the safety bar position, it shifts the center of mass forward and it places more demand on the anterior chain. That's what it comes down to. All right, one more study for the safety bar squat by Hecker et al. In 2021. They found that there is 11% less load lifted for the safety bar. There's less trunk and hip flexion. And this is really interesting. They threw in like trap EMG into this, and they found that there's more middle and lower trap activation. A lot, like way more, 50% more for high safety bar. My hypothesis is that because you're holding those handles, you can kind of squeeze them, push them together, use them to create more force in the shoulder area. And then they found less abdominal, less hamstring, less vastus lateralis, and less gastrocnemius in the safety bar squat, and more for the low bar. So in sum, Hecker cites that squatting with the safety bar squat results in a more upright trunk angle, which they think places less stress on the low back, which is a commonly injured area while squatting. Also, this decreases the lower extremity muscle activation, likely due to decreased load, suggesting that the safety squat bar may not be as effective as the standard bar to increase lower extremity strength. All right, so in sum, key takeaways, the more upright torso angle might be ideal for decreasing forces in the low back. And it may not be as ideal for maximal loading due to the more forward position of the load. And it achieves greater middle and lower trap activation. So if you're having a client and they're struggling to create tension in their body, the safety bar might be a good option to show them how to create more tension in their torso. Lastly, muscle activation may not differ significantly from the barbell squat. All right, landmine and goblet squat. We've got just one study to look at here because there was not much research on these exercises. They found that there was more vertical ground reaction force for the goblet, less for the landmine. Picturing that makes a lot of sense. For landmine, you're leaning forward. Like, look at this picture, you're leaning forward a lot, kind of going a little more horizontal. And then like the reverse was true for horizontal. Definitely more horizontal for landmine, less for goblet. And they found more quads for goblet. So some applications to this is that if we have a client with more of a horizontal force producing sport where they need to like move horizontally with a lot of force, perhaps you can use the landmine more. And I'm just going to read a few lines from the summary and the practical applications from this study. So they say that it has been recommended that the combination of both of these exercises may be most beneficial for sports performance. That makes sense. We want to be able to create lots of horizontal and vertical force. Got it? And we're going to move on. All right, so we're on the second to last type of squat. We're going to talk about Smith machine, and then last, we're going to talk about belt squat. So Smith machines are always controversial. People make fun of it. They're like, just do back squats. I won't say some of the terms they say, but they say, yeah, they make fun of you. They want you to back squat. It's like, Smith machine squats. No, don't use that. You can see some of the claims there. Now, the characteristic of a Smith machine is that there's a fixed bar path. You're not going to be able to move that bar at all, other than the track that it is on. Sometimes it's at a slight angle. But it's going to allow for a lot of customization of your stance. You can stand with your feet really far forward. You can, just having that bar fixed there creates a lot of stability and allows you for some more programming options. So we're going to look at one study, and only 6 participants in this study. So it's got a lack of power. So they did not reach statistical significance with this one, but it's the one that I found that had the most information. So they made this study to have applicability to typical training sessions where participants did free weights and Smith machine squats with heavy weights for high reps, 8 reps. A lot of these studies, they do like 1 rep max. And like, think about how often you do 1 rep max or your clients. Not that often. So I appreciate it when they do like an 8 rep max, because that's more typical of what we're going to be training in. And they cited another research article by Bem and Anderson, 2005, that found that Smith machine squats had less muscle activation compared to a free weight squat. However, that study, they used standardized sub-maximal loads. Whereas in this study, they used a load specific for each exercise where the participants could complete 8 rep max. So they put more weight on the bar for the safety squat bar because it's more stable, and they did 8 reps. So I think that helps this be more applicable to an actual training situation. So in contrast, though, to Anderson and Bem 2005, this study found that the Smith machine squat didn't to have more activation of the knee extensors. So that's different, because we kind of see, like, I hear online or see videos where they're like, oh, you're going to get less activation because it stabilizes for you. Well, they found there's actually more quads in this. All right, so, and we can just go down this table and see some of the differences. There's a lot more gastrocnemius because your feet are more under you in a traditional barbell back squat, whereas your feet are put more in front of you for the the Smith machine squat. Yes. Going down the difference. Oh, wow, no difference in rectus abdominis, no difference in lumbar erectors. Wow, that's pretty interesting. Is that just because there's a higher load lifted for the Smith machine? Not sure. So they said that one might postulate that there would be a higher activation of trunk musculature during the more unstable barbell squat compared to the more Smith machine squat. However, this wasn't the case. We could see it was the same amount. And they said this could be due to lifting more heavier loads for the Smith machine squat, which makes the stabilizers have to stabilize more to stabilize the extra load. So Key takeaways from this one study is that there's less quad activation compared to the barbell squat. And there's not less trunk activation like the people online say. And there was definitely less bicep femoris activation, which is a hamstring muscle, and less gastrocnemius activation for the Smith machine squat. And if so, they say free weights squats may be superior for training if the legs maximum leg activation is the goal. Okay, that makes sense. Also, great variability due to allowing stance farther from the bar path. So the Smith machine just might be a good option if you're looking to introduce a little bit of variability in the squat. All right, so just a few little things here and there that are interesting about the Smith machine. All right, so last thing, the belt squat. So unlike all of the squats we've looked at so far, the belt squat places the load on the pelvis, which bypasses the need to support the load with the upper extremities, like the back muscles and the trunk. And that has been found to be true in research by Joseph et al. In 2020. There are very few studies that compare belt squats to back squats. I looked for a lot and I found, I think, one or two. So there should be more research. That'd be interesting. And previous research found no difference in knee extensors and knee flexors, as well as hip adductors and abductors and plantar flexors and dorsiflexors. So basically, they found no difference from the ankle up to the knee muscle groups. However, interestingly, Evans et al. In 2017 found a decrease in glute max activity during belt squats compared to back squats, whereas Gulick et al. 2015 found no difference. So there's always going to be studies that contradict each other a little bit, so which is happening right here. So these conflicting results may be due to several factors, including the use of a different belt squat machine, different subject experience with the belt squat, using different subjects. So from this study by Joseph et al. 2020, we can see that there are some differences between the two. There's more glutes and more trunk stabilizers in the back squat. And that makes a lot of sense theoretically to me, because back squat, you need to have something stable between that load and the muscles that are moving it. Whereas in belt squat, that load isn't on your shoulders, it's right on top of those hips. However, there was a similar difference in quads and hamstrings between both of them. So the practical applications for this article is that this study supports using the belt squat to train the quads and hamstrings similarly to the back squat, yet with much less stress on the lower back and trunk musculature. And bypassing the trunk musculature could be advantageous to those who do not want to work out their low back or trunk, or to this degree, but still do some type of squatting exercises for the lower extremities. And if belt squats were to replace the back squats in the workout, they suggest that you do additional exercises to target the glute maximus, because in the belt squat, there's less gluteals that are worked. So that's the results from this study. Got one more, and we can see that there's more of an ankle moment and more of a knee moment in the belt squat. So it seems like it's like a little more knee dominant. That makes sense. You're very upright. You don't need to like bend the torso, bend the trunk a lot. And that is what gets a lot of posterior chain activation. So this is making sense to me. So practical application here from this study is that belt squats compared to back squats can provide a similar or even greater loading to the the quads while reducing external spinal loading. So belt squats could be really good for individuals with upper body or spinal injuries. So I have a client, we wanted to take a break from back squatting, still wanted to work the legs a lot. So we did a landmine belt squat where We put the chain around his hips, chain attached to the landmine. We're able to lift a lot of load, give his low back a break. His low back was really tight from playing a soccer game that week. And this was just a really good training option for us. So key takeaways for the belt squat is that there's more muscle recruitment for the legs, like the same, if not more, for the belt squat, but there's less glutes. Belt squats can be advantageous for reducing stress on the trunk. Not that stress is a bad thing. What stress really means is just tension, force being created. But if that's creating an issue for a client, then belt squats could be a good option to still train the legs, but take some of that load off of the back. And it's still a squatting exercise. It's still squat fundamental movement. And it's recommended that if you're replacing back squats with a belt squat, it would be a good idea to train some additional exercises to target the glutes and trunk stabilizers in a different way to make sure that those are still getting worked out. So we're all done looking at the research. We're going to wrap this up. So for this summary, back-loaded versus front-loaded, we can see some of the differences here. So looking at this, we can see that there is more vertical force production for the front squat. Front squat helps facilitate ribs getting down a little bit more, getting those abs turned on, getting that pelvic tilt more neutral. There's a more upright torso for the front squat, less hip flexion, less knee flexion. And we can see kind of the opposite is true for the back squat. For the back squat, there's more glute and hamstring stretch happening because there is less knee flexion. So for me, what I think there is like, if I have a client with really, really tight hamstrings, and whenever they squat, they get that butt wink or that big lumbar flexion, doing like a front squat, especially like onto a box or something, really helps because it takes some slack off of the hamstrings. But with like lighter loads, I still may want to do a back squat just to help get some tension and stretch, lengthen those hamstrings. So with all of this information we went through, it was a lot. I wanted to summarize it with 6 bullet points. So here's 3 of them right here. Number 1, loading position on the squat. It does have significant implications, as we just saw on the body. And we need to consider the client's needs and how the loading position affects them. And we want to choose a specific load position that can introduce more variability, align more closely with our goals, or serve as an individualized modification. And there is weak to moderate evidence that as the load shifts more posteriorly, muscle activation also increases in that posterior chain, and then vice versa. As it shifts more forward, there's some weak to moderate evidence that we get more muscle activation in the front. There is strong evidence that as the load position shifts posteriorly, absolute load lifted increases. There's strong evidence also that the load position affects the kinetics and kinematics in the entire body. Here's a visual summary of everything that we just looked at in like one picture. I tried to do my best to help you summarize this information in a lot of different methods. So we're going to talk about the backload. For backloaded stuff, the more backloaded it is, typically the more absolute load there is. And then there's kind of weak evidence that there's more glute activation, more erector, spine, more hamstring as the load shifts backwards. As the load shifts backwards, there's also weak evidence that there becomes less anterior muscle activation. As load shifts backwards, there's a greater hip moment and moment arm length. As the load shifts backwards, there is less knee moment and there is more anterior pelvic tilt. There is more hamstring lengthening and then less of an upright torso. Then read through the front loaded section. It's always like the inverse. So as I just wrap this up, we need to note that each of these studies, they use different methods, different participants, so limitations apply. That's why I put kind of weak evidence, because I didn't want to just take a study and be like, look, this is the truth. Because yeah, we saw some contradictions a little bit. All right. So we are basically done. We're going to do, you can end here or you can hang on with me and we can talk through this breakout group discussion, because this is a lot of information. We did sum it up, but it's like, okay, yeah, like I need to like apply it to some real life situations to like for it to stick for me to understand. So I wanted to provide some scenarios here to help with that, to really help this stick. Another learning style. So you can get off now, or you can stick with me, and I'm going to go through these 15 different scenarios and talk through them and tell you what I would do as a personal trainer considering loading position. So let's get into it. So for group one, we got a client. We want to program a bilateral squat variation. And this client presents with limited ankle dorsiflexion. All right, so thinking back, what would be the best load for them? We know that for low bar back squat, there's a really, really big hip angle, and there's not that much knee flexion, which means the knee is going to stay more upright over the ankle, which means less dorsiflexion. So with a client like this, I would have them train with some sort of load more posterior. So a front squat might challenge their dorsiflexion too much, and their heels might be popping off the ground. But like the caveat to this is like, you might want to spend some time actually training with front squats with this client too sometimes to get to push that dorsiflexion just a little bit, to provide an opportunity for those adaptations to take place. So we want to make sure we don't get into the mindset where, oh, my client can't do this, so we're never going to do anything that requires that. It's like a balance. So we always want to keep that in mind. All right, number two, we've got a client that has the goal of lifting as much weight as possible. All right, well, we're probably not going to be doing a front squat then. Probably not a safety bar squat. Low bar back squat, or some sort of squat where the load goes behind you, is going to be their best bet. That's what the research shows. All right, so we got a client. They present with an anterior pelvic tilt and lordosis during standing and exercises. All right, so we know that as load shifts backwards, it can create more of an anterior pelvic tilt. So I'm not going to want to reinforce that habit. So I'm going to do something more anterior, more front loaded. That's the correct answer. All right, group two, number one, they present with kyphosis. All right, so kyphosis and posterior pelvic tilt with a front squat. That front load is just going to probably push them more into that kyphotic posture. So I might want to do more back squatting with them. However, again, another caveat is I might want to do some lighter loads in the front squat position to force them to actively extend their spine more since they're kyphotic. But with the back squat, holding that bar back there somewhere, it's going to require them to extend as well. So it's a little bit more of like, are we actively getting them into more extension, or are we passively getting them into more extension by just having them hold onto a bar back there? All right, group two, question two, they want to prioritize more vertical force production. All right, we're going to do a front loaded thing. We're going to do goblet squat, barbell front squat, safety bar squat, something like that, because your torso is a lot more upright. They carry heavy loads on their backs due to their occupation. I'm going to have them do something with a front squat because they already spend so much time with a load on their back. I don't want to overdo it. I don't want to overstress that. I want to give them a different stimulus. Okay, group three, question one, they want to prioritize horizontal force production. All right, maybe like a landmine squat, something like that. More of the back squat. Now, the thing is interesting, landmine is very interior loaded, but you can really lean into that bar a lot. And it's kind of like the same as the Smith machine. That's kind of like, you can really lean into that bar a lot and get your feet more forward. All right, so you got a client, they have the goal of developing quad strength and quad hypertrophy. Well, there was like weak to moderate evidence that as the load is more in front of you, it's going to work the anterior chain more. So if they want their quads to get bigger, stronger, let's do more front-loaded variations of the squat. All right. This client was instructed by their allied health provider not to overexert their low back. So they're coming to you to have this apprehension. My doctor told me I can't overuse my low back. And my physical therapist said, no, using my low back. We can say, okay, well, the research has shown that front squat variations require less back stress, less force on the back, there's less stabilization. You can be very upright, it feels very safe because you're not bending over as much. So I would have them do a front squat variation. All right, last group here. They present with an erector spinae that are always shortened and always overactive. Their erector spinae love to just extend their spine. Okay, well, I'm not going to put a barbell back there and let those muscles continue to be over tight. I'm going to put the load in front to facilitate the ribs getting down, facilitate those abs getting more involved. All right, so this client now needs to stay out of too much hip flexion. They're having a hip flexion induced pain. We're not going to try to figure out what the pain's coming from right now. We just want to find an entry point exercise to get them training. What are we going to do? Well, we're going to do an exercise with less hip flexion, and that is a front squatted variation. Pick any one of them. Lastly, this client has the goal of increasing their hip range of motion in the deep squat. Well, we know that if you want to squat deep, front-loaded options work more because there is a lot more knee flexion, and you just get a lot deeper in the front squat. So I'd have them do front squat. All right, awesome. This is a hands-on practical for if this is being taught in person. What I would have groups do is be assigned a type of squat, give them a goniometer, and have them record the angles in the body so they can actually see hands-on what the biomechanical and kinematic differences are with loading position. And then I would also have the person lifting in the different squat variations self-report their perceived muscle tension or stretch from that position, and then share the results. Let's see if we can find some similar results as the research. Here are my sources. I've got 2 slides and a few more sources I need to add to this. But these sources came from a lot of the things that I was saying. And thank you very much for this presentation. I hope you learned a lot. I hope that now you see the importance of loading position in a squat and how it really has a big impact, and how it's just another tool that you can put in your tool belt to get your client squatting pain-free in a way that aligns with their goals. And thank you for listening.